Whenever a body tissue is injured, that is, whenever there is a tissue insult, it is natural and normal to have an inflammatory response. So inflammation is a normal response to any tissue injury. It's important to realise that inflammation is quite normal whenever the tissues are insulted. And as well as being normal, it's also necessary, because inflammation is actually the first and an essential stage of the healing process. So it's both normal and necessary. And it is a non-specific response. So the inflammatory response is the same regardless of what causes the injury. So there's different mechanisms can cause injuries, but the response is the same. The inflammatory response is the same. The tissues always respond with this same inflammatory response. And when the tissues are injured, there's going to be a local inflammatory response. And we can learn to recognise this, and we can incorporate this into our healing strategies. Local inflammation. But when a tissue is damaged locally, it will also release inflammatory mediators into the blood. And if there's a lot of local tissue damage, you're going to get a lot of inflammatory mediators released into the blood, and this can cause a systemic inflammatory acute phase response, sometimes called a systemic inflammatory response syndrome. So yes, it's going to be local, but if there's a lot of inflammation, then it can have systemic effects as well. And the term inflammation literally means to set a fire, because for millennia people have realised that when things are inflamed, they feel hot. At least if they're on the surface of the body, they feel hot. And this was first documented way back in the 1st century, just something like 50 years after the birth of Christ actually, by Cornelius Celsus, the Roman physician and documenter. And he noted that in inflammation you get heat, pain, redness and swelling. So way back in the 1st century, heat, pain, redness and swelling. And then about 100 years after that, the Greeks added another one. They added loss of function. So we call these now the cardinal features of inflammation: heat, pain, redness, swelling and loss of function. And the first person to realise and study this systemically and study this systematically rather, and realise that this had importance for healing and to study this in scientific terms was the great English anatomist and surgeon John Hunter. Now John Hunter served as an English surgeon in the 7 Years' War, 1756 to 1763, and obviously he was seeing a lot of military injuries. And at the end of that, he wrote the seminal work, A Treatise on the Blood, Infection and Gunshot Wounds. And that was the first time that inflammation had been scientifically studied, and the importance of inflammation came to be understood. Tragically, it was published in 1794, the year after his death. So people have known about this for a long time. And it's still important. It was important to the Romans, it was important to John Hunter, and as contemporary nurses and doctors, it's also very important for us to understand this process of inflammation. Now, I think what we'll do next is we'll look at the causes of inflammation. But just before we do that, I'll mention something you already know. Anything that's inflamed ends in itis. So if it ends in itis, it means it's inflamed. But let's look now at what can cause this inflammatory response.